Becoming a clinical psychologist seems pretty straightforward, doesn't it? You go to school, get your doctorate, and then you help people. But what if I told you that the very foundation of that training, how a psychologist is built from the ground up, all comes down to a single pivotal question that the field has been fighting over for more than 50 years? It's a question that literally defines the architecture of a psychologist's mind.
And here it is. This is the big one. Should a clinical psychologist be a scientist first or a healer first? It seems simple, but your answer completely changes the kind of psychologist you become because it dictates the entire architecture of your training. So at the heart of this whole debate, you've got these two fundamental roles. On one hand, you have the consumer of science, the person who has to stay on the cutting edge of research. On the other, you've got the practitioner who works directly with people in pain. Now, this conflict isn't just some philosophical coffee shop debate. It has created entirely different blueprints for training. And today, we're going to unpack them. All right, let's dive in. We'll start with the very first formal answer to this debate, a blueprint that was actually born directly out of a major historical crisis. Okay, so picture this. The year is 1945. World War II is over, and an absolute flood of veterans are returning home, many in urgent need of mental health care. The demand was just overwhelming. The American Psychological Association knew they had to do something. They needed a standardized, high-quality training model, and they needed it fast. And that urgency led them straight to the 1949 Boulder Conference in Colorado, where the first universal standard was officially born. And this is what they came up with. It's called the Scientist-Practitioner model, or as most people know it, the Boulder model. Their big idea was this ambitious, perfect 50-50 balance. The logic was, you had to be a sharp consumer of research to stay effective over your whole career, but you also had to stay in touch with real human suffering, to ask the questions that actually matter. You had to be a psychologist first and a practitioner second. And you can really see that 50-50 split when you look at how the programs were built. The first couple of years are all about core coursework. Year 3, you get into the practicum. That's your supervised clinical training. And then, and this is the big one, year 4 is all about your original doctoral dissertation. We're talking a massive original research project. The whole thing wraps up with a full-time, 40-hour-a-week internship. This was the gold standard for a while. But then, well, the real world came knocking. Okay, so that brings us to the next big chapter in our story, where we see how real-world market forces started to really push back against that original perfect blueprint. So what happened? Well, during the 60s and 70s, as you can see right here, psychologists started moving out of university jobs and into private practice in huge numbers. And for these folks on the front lines, that rigid 50-50 model just felt impractical. Critics like a guy named Drabeman pointed out a massive flaw. PhD students were showing up to their internships as research whizzes, sure, but they often lacked the basic, vital skills to actually give and score psychological tests. And all that frustration, it gave birth to something new, the PsyD, or Doctor of Psychology. This model got its official blessing at the Vail conference in 1973, and it was the pragmatic, market-driven answer everyone was looking for. And just look at the allocation dial here. The focus totally flips to about 80% practice and just 20% science. That super heavy dissertation got swapped out for something like a detailed case study, putting all the emphasis squarely on clinical work. And this change wasn't just on paper. It was a total earthquake for the institutions themselves. The PsyD basically launched the rise of what are called freestanding professional schools, places that were completely separate from traditional universities. Unlike those old PhD programs that were funded by the state, these new schools ran on tuition, were often staffed by working clinicians as adjunct faculty, and were 100% focused on professional training. So let's do a quick check-in here. On one side, you have the PhD, that classic Boulder model. It's got that 50-50 science to practice focus, requires a huge original dissertation, and it's really built for careers in academia or research. On the other side, you've got the PsyD, the Vail model. It's more like 2080, asks for a clinical case study, and is designed from the ground up for people who want to be dedicated private practitioners. Two very different paths. But, for every action, there's a reaction. And just when it seemed like the field was going all in on practice, a group of people slammed on the brakes, worried that psychology was losing its scientific soul. Okay, so by 1991, some psychologists were getting really worried. They looked around and saw the field drifting away from science, using all kinds of therapies that had zero controlled validation. A guy named Richard McFall wrote what he called a manifesto, and it was a serious call to action. It basically drew a line in the sand, saying any psychological service must meet 4 criteria. It has to be described clearly, its benefits stated up front, it has to be scientifically proven to work, and it needs to be checked for any negative side effects. And out of this pushback came our third major blueprint, the clinical scientist model. And listen, this was no compromise. This was a complete doubling down on research. The goal, as McFall himself put it, was to produce the most competent clinical scientists possible. Basically, people who think and act like scientists in every single thing they do. This was the 100% science answer to that original question. And then there's one more model that took a totally different approach to solving the problem. It's called the combined model. And it's not so much about the scientist versus practitioner debate, it's about breadth. It's designed to produce versatile generalists by mixing the core knowledge of clinical, counseling, and school psychology. It's a great model for jobs in the private sector, but that broad approach means it doesn't have the deep specialty focus you need for the most competitive research jobs.
Okay, so that's a lot of history, right? But what does all this fighting and all these competing blueprints mean for you if you're trying to choose a career path in this field right now?
And this brings us to a really crucial point about today's job market. It is seriously lopsided. The huge number of graduates coming out of those practice-focused PsyD and professional school programs has created a massive bottleneck. We're talking fierce competition for the required internships and for those first entry-level jobs. Meanwhile, there's actually an undersupply of research-focused psychologists, which means the scientist-practitioner and clinical scientist programs are often in a much better spot to meet the needs of universities and research institutions.
And adding even more pressure to all of this is what's called the managed care revolution. Basically, insurance companies now want to see the receipts. They are demanding quantifiable results, which means practitioners have to focus on therapies that are empirically supported, time-limited, and targeted. The bottom line here is crystal clear. No matter which training model you come from, those skills in empirical evaluation are no longer optional. They are absolutely essential to compete.
Which brings us to this incredibly useful decision tree, so let's walk through it. What is your number one career goal? If it's pure clinical practice and you're okay taking on some pretty high student debt, then the PsyD path makes a lot of sense. If you see yourself working with all kinds of different people across different systems, the combined model is a great fit. But if you want to be the one who innovates new treatments or writes the big grants, the clinical scientist model is your blueprint. And if you want that balance, in a funded university program, you look right back to the original Boulder model PhD.
In the end, it really boils down to this. There is no single best model. The right choice is a personal calculation. It's that exact intersection where your own career dreams meet the real evolving demands of the marketplace. So the final question isn't just scientist or healer. It's which architecture are you going to choose to build